Then the final valid code with rules and instructions.
Correct. So even though you're going by alphabetic index, in alphabetic index, as you all know, we will be having all the medical condition listed alphabetically, irrespective of their chapter. Okay, all medical condition will be listed alphabetically. So what you will do, you will go by medical term and you will see what is the direction is there in alphabetic index. Sometime you will get a final code there also, but it is not always possible. So we will come to tabular list with the alphabetic index direction, and for any exclude one nodes, code first, code also, use additional, exclude two instructions. All of these instructions you will be finding in the tabular list only, so that you have to finalize your TD code with the tabular list. Okay, option B is correct. What does NOS stands for? NOS stands for not otherwise specified. And when we will use NOS conditions, NOS,
B, ma'am.
not otherwise specified. Not otherwise specified is equivalent to unspecified. Just remember these things. It is equivalent to unspecified. So whenever the doctor is not giving you full information about the medical condition, okay, you have enough ICD codes in your book for the same category or for the same medical condition. So if the doctor is documenting patient is having cough, okay, he is not documenting whether it is an acute cough or a chronic cough or a persistent cough. Okay, likewise details he is not giving. So at that time you cannot assume it's an acute cough or a chronic cough or a persistent cough. Likewise you can't assume. You have to go with cough unspecified. Okay, so the provider is unsure or has not given enough detail, so the condition is unspecified. Okay, again option B is the answer. Next, what does NEC classified? NEC refers to not elsewhere classifiable, correct? So whenever, when do we use this NEC conditions?
A specific code does not exist for the documented condition.
Correct. Okay, the specific code does not exist for a documented condition. So here when provider, like he is giving enough detail for us, but in our ICD manual, we are unable to find a proper ICD code for his clinical definition. Okay, we are leading to the medical condition, but whatever the variant he is mentioning or whatever the type he is saying, we do not have a code. Okay, that time we have to select the medical condition end with NEC. Okay, not otherwise specified. So we have to go with C here. Then what does an exclude one note mean?
The two conditions cannot be coded together.
Correct. So whenever you see, like example, we have taken a lot of example we have already discussed. So whenever you have two medical condition in your medical record, you must verify both of their exclude one instructions. Okay, just verify, go and check both condition exclude one instruction and see in any of those conditions, whatever the current condition you're going to code is there or not. Okay, so for example, we taken an example type 1 diabetes and type 2 diabetes. So if you go and check type 1 diabetes exclude one instruction, below to that we can see that type 2 diabetes is coming under exclude one note. Okay, so that shows you cannot process both type 1 and type 2 diabetes at the same time. Okay, so that is what exclude 1 refers to. And exclude 2 means both condition may be coded together if it is applicable. So like if you see any condition which comes under exclude 2 that you're going to code on the same day, you can process both of them. Okay, no need to remove any one particular medical condition. So I think we have discussed enough examples. So if you have forgotten, please once go back and review both exclude 1 and exclude 2 instruction. So in all the interview, you will be questioned on NOS, NEC, exclude 1 and exclude 2. Okay, these are all very basic so that you should have a good understanding. So how should the word and be interpreted in ICD-10-CM? So and is equivalent to
And or C.
R. Okay. So throughout your ICD manual, whenever you see and, you can also interpret it as R. So what is the purpose of parenthesis? So in the parenthesis, you will be seeing sometime non-essential modifier or essential modifier. That means one more word you will be seeing. Will that affect your code assignment?
No, ma'am.
We have taken example hypertension, primary hypertension, essential hypertension. In that the word essential, was that affecting our code?
No, ma'am.
So you can see essential, primary hypertension. So primary is there within the parenthesis. So this is what this is called, essential or non-essential modifier. If it is there also, if it is not there also, it does not affect your code assignment. Okay, so that answer will be to show optional word that do not affect the code selection. So when should a combination code be used? So whenever we will be using the term with or due to, okay, in which scenarios we will utilize combination codes?
One code fully describes the condition and its complication.
Correct. Okay, so you may have 2 to 3 conditions sometime. You may have 2 to 3 conditions, but a single ICD code is defining all the 2 conditions together. Sometime it will be an association process, like a complication will be there. Sometimes secondary process of condition will be there. Okay, so we have seen a lot of hypertension, CKD, diabetes with CKD, diabetes due to coma. All of those will be referred as a combination code. How are sequela or late effect be coded? So the sequencing rule for sequela is very important. So which one should be primary diagnosis and which one should be secondary diagnosis? If I take example, patient suffered with burn, later in his life he developed scar, and today patient is here to take the treatment for scar.
Sequela code first.
So which one, scar or burn?
Condition.
What is the today's condition? Today, reason for encounter. He was suffered with burn, but later he developed scars. He taken treatment for burn and it was resolved, and later in his life he developed scar. Correct.
Yes.
So the scar is considered as nature,
First.
current nature. Okay, or the residual condition, late effect. Okay, so scar will be coded as a primary diagnosis, and I have already given you the instruction. The code which ends with yes, okay, that will be coming in which place? 7th character as yes will always be coded as a secondary diagnosis. Okay, so that is an easy reference. So first you are going to code today's nature of effect, scar. The L series will be coded as primary diagnosis, and the S code which comes from burn, the T series code will be coded as secondary diagnosis. Okay, same way, another example we discussed, that is deviated septum with a due to nasal fracture. 5 years ago, patient suffered with nasal fracture. Now he came to take the treatment for deviated septum. So which one will come first?
The deviated septum.
Correct. The deviated septum will be coded as primary diagnosis, and the last nasal fracture he suffered with, that particular nasal fracture with the character yes, will be coded as secondary diagnosis. Okay. So if a condition is a bilateral and no bilateral code exists, how should it be coded?
Assign separate left and right codes.
Yes. Okay, correct. So we already discussed enough on this also. If condition is a bilateral, so they say patient is having bilateral shoulder pain. Patient is having bilateral shoulder pain. That means he also has pain on right shoulder. He also has pain on the left shoulder. But if you go and check the pain category for shoulder, you will not find any bilateral code for shoulder. Okay, bilateral pain in the shoulder, you don't have code. So in this case, you can go ahead and code them separately. Assign left versus right. But if you had a bilateral code, like we saw, what to say, some of the ocular pain we saw, right? So if we have the bilateral code, then can we able to assign them separately? In
No,
the
ma'am.
category, if we have the bilateral condition code, you have the bilateral condition and you are checking the code category, there also you have the bilateral code, means you cannot split and you cannot code them separately. Okay, assign separate left and right since you do not have code for bilateral. So when does code first instruction, sorry, what does code first instruction mean?
Code the underlying condition first.
Correct. Okay, so whenever you see a manifestation code, below to that you will be seeing a instructional word as code first. So for that code first, that means whatever the list of code first they'll give, in that any of the condition which we can see in our medical record, that will be our underlining condition. So the underlining or the etiology condition should be coded as primary diagnosis. Then you will be processing your manifestation code in the secondary diagnosis place. Okay, important. So next, if the same condition is documented as both acute and chronic and two separate ICD-10-CM code exist, how should it be coded? So this one actually I did not explain at that time because I was just looking for a example. So in this case, if they're saying like you have a single condition, but that single condition doctor has provided the details like acute versus acute version also, chronic version also. In this case, you will go and check the category. Do you have a separate code for acute condition and chronic condition for the same medical condition? Example. So here is an example. Okay. So acute and chronic condition. So say for example, provider has documented patient is having acute tonsillitis. Okay. As well, chronic tonsillitis. Patient is also having chronic tonsillitis. Both. Here it is. Acute tonsillitis and chronic tonsillitis. So in this case, as you can clearly see, there is one ICD code for chronic tonsillitis and there is one code for acute tonsillitis also. Okay, so what we can do, since we have the codes for both acute version and the chronic condition of the same medical condition. Tonsillitis is the condition and doctor has said acute and chronic, both information is available in your medical record. So as you can see, there are codes for both the variant. You can go ahead and assign both of them. Okay, you can code J03.9 also. You can code J3501 also. Both of them should be coded. But the sequencing is very important. So sequencing is you should prioritize acute condition as a primary diagnosis and chronic condition as a secondary diagnosis. So here J03.9 acute tonsillitis is what we have. This will be coded as PDX and chronic tonsillitis will be coded as secondary diagnosis. Okay, this is the sequencing rule. Whenever you have same medical condition with the information being acute and chronic. Okay, understood? So the answer should be, which one should be sequenced first?
Acute condition first. B.
Code acute condition first. Okay, this is also important. So next, a patient tested HIV positive. the patient has no signs or symptom related to HIV and he is being completely asymptomatic. So you just have HIV test positive, but you do not have information anything related to HIV related condition, or he is not also having any sign and symptoms. He's being asymptomatic. So which one you will go?
See, ma'am, Z21, Z21.
Correct. Okay, you have to go with Z21. Whatever we have asymptomatic HIV code, that should be coded. Okay, if you had an information patient is tested with HIV and provider may also documented some anything related to HIV related condition, or if he has said HIV disease, if he has used HIV disease, then which one you would have coded?
B20.
B20. Okay, if he says on this documentation, if they additionally give patient is being asymptomatic only, but along with the HIV test positive, the doctor has said patient is having HIV disease. He concluded disease, or he has documented AIDS, or maybe anything HIV related conditions, Kaposi sarcoma. Okay, anything like related HIV if he documents, you will go with B20. But as of now, you only see HIV test as positive, but it is being completely asymptomatic. So you will go with Z21. So next, patient is admitted with pneumonia. The provider documents pneumonia is due to MRSA. Do we have combination code here?
Yes, ma'am.
You have added already correct answer. Okay. So here, as you can see, there is a combination code. The software is too slow today. Okay, you can see pneumonia due to MRSA. Okay, this code will be assigned. So patient is admitted solely for administration of chemotherapy for acute lymphoblastic leukemia. So now patient is admitted chiefly for chemotherapy only. Okay, to take the treatment for ALL, acute lymphoblastic leukemia. So the reason for encounter is what?
Chemotherapy.
Chemotherapy. Okay, so Z code should come first, or C code should come first?
Z code should come first.
Z code should come first. So you need to code for chemotherapy. Encounter for chemotherapy code should be coded. So check the chemotherapy code. Z5110 or 11, you can check. So encounter for anti-neoplastic chemotherapy Z5111. So you will be assigning Z1111 this code with C91.00. Okay, this is acute lymphoblastic leukemia code. So you know the guideline. So you are going to sequence PDX as chemotherapy code, and then you're going to code your cancer code. So next, patient undergoes surgery for liver metastasis from the lung cancer. Treatment is directed at secondary site. So you know the sequencing rule of neoplasm also. If they give treatment towards primary site, that primary site will be coded as PDX. Same way, if they give treatment towards secondary site, the secondary site will be coded as PDX. Okay, so here patient got lung cancer. Patient got liver metastasis. Metastasis is nothing but the secondary site. So from lung being primary site here, from lung, it got metastasized to liver. So now patient is suffering with both liver cancer also, lung cancer also. But today's treatment is directed towards the secondary site. That means towards liver they have given the treatment. So which one should come as PDX?
The liver metastasis.
Correct. Okay, the liver metastasis should coded as PDX, primary diagnosis. So you can check the code C78.7. Secondary malignant neoplasm of liver intrahepatic bile duct. This will be coded as primary diagnosis. And then it was metastasized from which side? From the lung.
Lung.
Okay, so for lung cancer, this will be coded as, you can see, malignant neoplasm of unspecified part of unspecified bronchus or a lung. C3490 will be coded as secondary diagnosis. C will be correct. So next we have, the patient has type 1 diabetes with hyperglycemia due to mechanical breakdown of an insulin pump resulting in underdosing. So this is again a coding guideline. Which coding guideline we need to apply here? So
Type
firstly,
1 diabetes.
yeah, so chapter 4 coding guidelines. So here patient mechanical breakdown. So insulin pump malfunction, what we have, that particular coding guideline you need to apply. So patient resulted in underdosing. Resulted in underdosing means, okay, first, anyway, whenever you encounter this scenario, the primary diagnosis should be what? Mechanical complication. Okay, first one, primary diagnosis will be mechanical complication, and then secondary diagnosis will be what happened, whether it is underdosed or overdosed. Okay, this one should be coded as secondary diagnosis. And in the third, tertiary place, what type of diabetes or what type of condition patient is currently having. Patient is having type 1 diabetes with hyperglycemia. So this condition will be coded in tertiary place. Okay, so now just look for the mechanical complication code T85 3X. Not T85, no, T38, sorry. Okay, T38 3X1 is poisoning code. So this is underdose means not poison, right? So it should be 3X6. So underdosing of insulin and oral hypoglycemic. So this T38 3X6A should be secondary diagnosis because we are dealing with the underdosing code. Same way, first primary code should be coded with T85 614A. So breakdown, mechanical failure of insulin pump, initial encounter. So this should come, T85 should come, mechanical complication should come first as a primary diagnosis, then followed by underdosing, and then lastly you're going to sequence your type 1 diabetes mellitus with hyperglycemia as a condition. Okay, this is the sequencing rule. So same thing you have to sequence, like whenever you get this scenario, you must apply the guideline and you should code it accordingly. So option B is correct. Provided documentation state that patient has alcohol use, alcohol abuse, and alcohol dependence. Which condition should be coded? So now you have all alcohol use, abuse, dependence. Okay, so which one you will choose?
Dependent.
Alcohol
Dependence.
dependent. Okay, dependence you should go because the most severe one is dependence. Okay, so check the code F10.10 and F10.20. If you check F10.20, it says alcohol dependence, and this F10.20 will be coded. Provided documents hemiplegia affecting right side with no further specification. So you have patient is suffering with hemiplegia which affected the patient right side of his body. But doctor did not tell you whether right side was dominant for the person or non-dominant for the person. Okay, they did not tell you the dominance information. So now you need to apply the default coding rules. So for right side of the body, what is the default?
Right side only.
Dominant.
Right side dominant. Okay, for
Dominant.
right side dominant you should choose. Same way, if they give hemiplegia affecting left side and no further information, for left side you will go with
Left side only. I mean, dominant only.
left side non-dominant. Okay, so you are not getting what I'm saying here. Hemiplegia affecting right side. This is the laterality. When I refer right side and left side, which is being laterality specification. Okay, so after specifying the laterality, it is provider duty that he must also document the patient condition, like like what to say, if his right side is being affected, he should also ask the patient whether this right side is dominant for you. Do you regularly use right hand? Okay, or you are like, you are a left-handed person and you are not at all using right side of your body. So that is the information the provider should take from the patient. Okay, then further whatever he will document, you will follow that and you will take the dominant code accordingly. But if you only end up giving you laterality, we have the default rules, right? We discussed those rules, right, in that day. Okay, here. So in our question, the doctor said patient is affected right side of the body. But he did not say whether right side was dominant for the person or right side was non-dominant for that person. He did not tell that information. So that what I will do, I will apply my default coding rules. So right side is affected means you will take default as dominant. Okay, same way, left side is affected and doctor is not giving you information that left side was dominant or non-dominant for the person, you will go with default
Non-dominant.
non-dominant. And same way, the doctor said left side being affected, but this left side was dominant for the person. He was a left-handed person. That side only being affected. Can you still code left side non-dominant code as a default rule? Or you will follow whatever the doctor says. He says left side was dominant for the person. Then you will go and take the particular
Dominant.
code. Dominant code. Left side dominant code you will take. So this is very important. Do not get confused, okay? G80, G81. Here, hemiplegia unspecified. Now I have only information in this question. They say provided documents hemiplegia affecting right side. Further, with no further specification. The dominance information they have not given. So what you will do, you will follow the default rule. Whatever the guideline says, for right side, you have to code dominant as default. So you will come and take the code hemiplegia affecting right side, right dominant side you will take. G8191 code you will assign. Okay, that is the default rule. What if the doctor says patient got hemiplegia affecting right side, okay, affecting right side, but The right side was non-dominant for the person. Right side was non-dominant for the person. You got the additional information where he was not a right-handed person. It is being non-dominant for that patient. So that time, what is your ICD?
G 81.93.
Correct. G8193. Hemiplegia affecting right non-dominant side. Because the provider is very sure and he has given you the specification of the dominance. So you have to follow what he says. Only if he is not mentioning the dominance information, then you have to implement your default rules and code accordingly. Okay, important. So as of now, I will be taking G8191, following my default rules. Patient admitted with glaucoma stage 2 during the same hospital stay provided document progression into stage 3. How should glaucoma coded according to ICD-10 guideline?
Stage 3 glaucoma. I mean,
The highest stage
number
will
of
be
yeah.
coded. Correct. Okay. So this also we saw there is a clear information. So patient admitted with a glaucoma and stage evolves during admission. You can check if patient is admitted with a glaucoma and stage progress during admission, assign the code for the highest stage documented. Okay, so the answer is code only stage 3 glaucoma. Then the patient is admitted for a treatment of Kaposi sarcoma of the skin. The medical record states that patient's HIV infection has been symptomatic and from the past year, and which code should be assigned. So Kaposi sarcoma is HIV related condition. So patient admitted for HIV related condition means what should be your primary diagnosis?
The Kaposi sarcoma.
B20 HIV, ma'am.
B20.
B20 should be your primary diagnosis because patient is admitting for HIV related condition only. Okay, if patient comes for HIV unrelated condition like fracture, that fracture will be coded as primary diagnosis.
Right.
So in this case, you will be assigning HIV B20 as primary and Kaposi sarcoma as secondary diagnosis. So Kaposi sarcoma of skin, correct code. So here we have skin. So you will select option B. Patient is admitted to hospital with a sepsis and acute renal failure and secondary to sepsis. Which code should be assigned? So you have to follow the sepsis coding guideline. What is the sequencing rule for sepsis?
Sepsis, severe sepsis.
Yes, sepsis and this acute renal failure.
Correct. Okay, you will be coding sepsis code first. You will check sepsis organism is identified or not identified. If it is not identified, you will code A41.9. Okay, then you will code severe sepsis code. Then you have to check whether septic shock is there or not. If septic shock is not there, you will go with R65.20. And lastly, in tertiary place, whatever the organ dysfunction they have given, that organ failure code will be assigned. Okay, so answer is C. A41.9 is sepsis code. Do you see any organism being identified for sepsis? Nothing they have given. No, only they said patient is having sepsis.
Sepsis only.
So that you will just code unspecified variant, sepsis, unspecified organism. A41.9 you should code. And you should code it as a primary diagnosis. And if they have said anything, any organism was identified, then that combination code you would have assigned. Like with organism code, you should have assigned. Next is severe sepsis code. R65-201 code you have, which says
severe sepsis.
it says severe sepsis without
Shock.
septic shock. And if you had an information about septic shock, then instead of coding R65.20, you would have coded R65.21, severe sepsis with septic shock. Okay. So in our question, there is no septic shock. So you just have to code R65.20 and then the